Yes.
Knock, knock. Hi, how are you?
Good, how are you?
So far, so good. My name's Shelby. I'm going to be the nurse taking care of you today. We're going to do a basic physical assessment just to make sure that all of your systems check out and everything's going okay for you. Let me wash my hands. So, what's your name?
Melinda.
Melinda. Where are you from?
Miami.
Miami. How do you like it down there?
I like it.
You like it? Are you a Dolphins fan?
No.
No? Oh, that's sad. Do you have any children?
I have 2 children.
2 children? How old are they?
19 and 6.
Do they live at home with you?
One lives at home, one's in college.
Okay. So what I'm doing right now is trying to establish a rapport with my patient to make sure that she has the appropriate eye contact, that my basic assessment of visualizing her skin, that she doesn't have any damage or lesions, bruises, contusions, anything like that. Make sure she feels safe in her environment, see what her home life is about, and also, again, establish a rapport with the patient because we're going to be doing not anything invasive, but we are going to be exposing her at times. So we're going to start with your with the skin. I make sure, she's got clean hair. She, again, has no contusions or bruises all over her arms and legs, face. I'm going to be lifting up, showing your legs. All right. So her fingers, her nails are clean, which is important because it shows her health habits are proper. She has clean hair, looks pretty kempt. So we're going to be evaluating your cardiovascular system. I'm going to listen to 5 main points in her heart, her pulmonic, her aortic, her pulmonic, Erb's point, tricuspid, and then the mitral or the apex, which is almost under the breast. So I'm going to auscultate all of those areas. When I do that, I'm also going to visualize to make sure when I remove the clothing down, I'm going to visualize to make sure she doesn't have any surgical scars or bruising, any kind of swelling, anything abnormal. All right, so I'm going to lower your shirt down. I'm going to go up under. All right. So when auscultating, I'm making sure that she doesn't have any apparent murmurs that I can hear, that she's got a regular rate and rhythm, that she's not tachycardic or bradycardic, which means a very high heart rate or a very low heart rate. After that, I'm going to assess her respiratory system. Basically, I'm going to be looking for the rate and rhythm to make sure that she's not labored in her breathing, that she's taking normal deep breaths, but not too deep and struggling for air. So I'm going to have her sit up for a second. And we're going to do what's called tactile fremitus. It's basically looking for consolidation or hyperinflation in the lungs. And you do that by having your patient, can you repeat 99?
99.
99.
99.
And just keep saying it.
99. 99. 99. 99. 99.
All right. So you feel a little bit of a rumble, but nothing too deep. If it's hyperinflated, then it will be more of a high pitch or more of a on your hands vibration. Thank you. So I'm also going to percuss her back, which basically all you're doing is tapping to look for consolidations and any condensed areas. our area of consolidation. All right, I'm gonna auscultate her lung bases. Can you take a deep breath? So all of her breath sounds are clear. I don't hear any ronchi or any gunky sounds. No wheezing that could show if she has some kind of problem like asthma or COPD and having a little exacerbation. So the next system that I'm going to check out, you can go ahead and lean back if you'd like, is the vascular system. So I'm going to check for JVD or jugular vein distension. I'm going to have the patient turn her head towards me, make sure there's no prominent veins bulging, and this way. The next thing I'm going to check is her carotids. I'm going to auscultate them with the bell part of my stethoscope. I'm going to have the patient take a deep breath and hold her breath while I'm trying to auscultate. If you can take a deep breath for me. All right, go ahead and have one more deep breath. All right, and it sounds appropriate. No, there's bruise noted, but not anything that is concerning at this point in time. The next that I would do is check her brachial pulses. And it appears that her pulses are at about a 3, which means they're normal. They're not bounding, but they're not weak. I'd also check her cap refill to make sure that it's less than 3 seconds. Her femoral pulses are right here, but I won't be palpating those today. I'm going to uncover her legs. I'll also check her popliteals. Dorsalis pedis. Posterior tibia. All of her pulses are at about a 3. You can see in her leg that she doesn't have any edema bilaterally, that she's got an appropriate vascular system, that there's no blanching. I'm going to have you push your feet back. Push forward to me and pull back. I'm checking for a Homan sign just to see if the patient has any kind of blood clots in her legs. All right. The next area that I'm going to be checking is her abdomen. I am going to be exposing your stomach. Is that okay? All right. So you want to make sure that you provide the patient a little bit of dignity and respect their privacy and not exposing them, and also not touching them without telling them what you're doing. So I'm going to start with auscultation. I'm going to listen to all 4 quadrants. Basically, I'm listening for normal active vowel sounds, if they're hyper or very grumbly, or if there's no vowel sounds or very minute, it could show some kind of issue in the abdomen. For the most part, her bowel sounds are normal. Are you a little hungry?
Yes.
Yes, I can tell. She's got a little hyperactive in the stomach area. The next thing I'm going to do is palpate for tenderness. In the right lower quadrant is where you find the appendix and also sometimes any kind of ovarian problems. But since she's had a complete hysterectomy, do you still have your ovaries as well? I do. Oh, well, then she can still have this. So you're going to start with a 2 to 3 centimeter light palpation. Do you feel any pain? No. Up here is her liver, and also has her gallbladder, which are the most common things to give people problems, and also her pancreas. Any pain? No. And then next I'm going to go to the area where her stomach and her spleen are, and then back down to where her colon is. All right. Any pain?
No.
No? All right. So deep palpation is something that I don't typically do, but we're going to be doing for this purpose. Basically what I'm feeling for is any hardening in her liver. Can you take a deep breath? I'm going to kind of stick my fingers up under her rib cage, trying to feel for the border of the liver. If there's anything there. Is that tender? No? And also you can feel for any enlargement in her spleen. All right. And I forgot, I've got a percuss as well to look for any areas of density. Stomach sounds a little empty. All right. Well, that's pretty much the end of my health assessment. I'm going to wash my hands and thank my patient for being so patient with me. I appreciate you coming in. Everything appears to be normal at this point in time, but make sure you follow up, keep not smoking, drinking, doing all the healthy things that you do. All right. Thank you.